Dr. Ted Delbridge. We're here to provide an update on our ongoing statewide public health response to COVID-19 and the Delta variant. I want to begin by thanking the millions of Marylanders who have rolled up their sleeves and gotten vaccinated. Earlier this week, the nation finally hit President Biden's July 4th goal of getting 70% of adults vaccinated. Here in Maryland, through our No Arm Left Behind efforts, we achieved that milestone back in May. In fact, we're already heading toward 80%, with 77.9% of adults now vaccinated. And we've vaccinated 93.4% of all Maryland seniors. You know, while most states have seen their vaccination rates drop off over the past several weeks, Maryland has continued to sustain a daily rate of more than 11,000 shots per day. As a result, we continue to have some of the best health metrics and one of the strongest recoveries in the nation. Maryland is much better prepared than most states to withstand the very significant summer surge of the Delta variant, which the other states with low vaccination rates are now experiencing. Right now, just 3 states, Florida, Texas, and Louisiana, account for 1/3 of all the new cases in the country. They are seeing their highest number of cases per day and their highest hospitalization levels of the entire pandemic. The Delta variant is spreading like wildfire in areas with lower vaccination rates. In Maryland, our very high vaccination rate is helping us contain the fire. Sadly, in some states, these are actually the darkest days of the entire pandemic. While fortunately in Maryland, our hospitalizations are down 83% from their peak, and deaths are down 94% from their peak. We have one of the lowest case rates and the lowest positivity rates in the nation. Being one of the most vaccinated states in America, and with our low metrics in comparison to the rest of the country, Marylanders should feel confident about going about our daily lives, keeping businesses open, getting even more people back to work, and getting our kids back to school. We are, however, very concerned about this new Delta variant and an increase in infections among the unvaccinated. Look, there's an incredible amount of misinformation, confusion, frustration, and fear out there right now. But from day one of this pandemic, I have followed the science, stuck to the facts and the data, and have always given it to you straight. And that's exactly what we will continue to do. So here are the facts as we know them. The Delta variant is, without question, far more serious than the original COVID-19. In fact, it is 2 to 4 times more contagious than the original virus or any variant that we've previously had to deal with. Through the robust sequencing program that we established in the spring, with tests for these variants at a level much higher than the national average, we know that right now the Delta variant accounts for nearly 100% of the new cases currently being sequenced in Maryland, and it accounts for 93% of all the cases nationwide. We also understand that it may cause more severe illness than the earlier variants. We do need to take the Delta variant very seriously. After consulting with our team of public health experts and consistent with our science-driven and data-based approach, today we are instituting new vaccination requirements for state employees who work in congregate settings dealing with our most vulnerable citizens. This includes state employees in 48 different facilities, including healthcare facilities of the Maryland Department of Health and facilities of the Department of Juvenile Services, the Department of Public Safety and Correctional Services, and the Department of Veterans Affairs. The state employees who work in these congregate settings will be required to show proof of vaccination. If they are unable to do so, they will be required to adhere to strict face covering requirements and will be required to submit to regular ongoing COVID testing. These protocols will take effect as of September 1st, by which date they will need to have received their first vaccine. Anyone attempting to provide false proof of vaccination will be subject to disciplinary action. These actions are being taken to further protect our most vulnerable citizens. The state will lead by example with our own employees who are working in congregate facilities. But today we are also strongly urging the private operators of the state's 227 nursing homes to institute similar vaccination requirements for their employees, just as the state's major hospital systems have already done. While our data does not show infections among nursing home residents increasing, we are seeing an uptick in unvaccinated staff member infections, which was a consistent source of the earlier outbreaks among nursing home residents, which resulted in so many deaths. The Maryland Department of Health will consider taking further actions if necessary. Since May, when our mask mandate was lifted, the Maryland Department of Health has strongly recommended that unvaccinated individuals wear a face covering in indoor settings and situations where physical distancing cannot be maintained. And this continues to be the strong recommendation. Businesses and other workplaces across the state are able to set their own policies to protect public health as they deem appropriate, and we support their ability to make those decisions. The state is not imposing any new restrictions or mandates at this time. Mask mandates or shutdowns will not be able to eradicate the threat of the virus or this Delta variant. The purpose of those mitigation measures last year, when there was no vaccine or any kind of widespread testing or PPE, was to save lives and to keep hospitals from overflowing and to give our healthcare system time to expand capacity and to adapt. Since the beginning of this pandemic, I have repeatedly stated that our primary goal was preventing hospitalizations and deaths, and that continues to be our focus. Now, while hospitals in some less vaccinated states are peaking and at capacity, Maryland is not near any of the 3 pandemic triggers that we have instituted. We remain at very low levels of hospitalizations and well within our capacities. There is nothing more effective at saving lives and keeping people out of the hospital than the vaccines, which are doing exactly what they were designed to do, which is preventing serious illness, hospitalizations, and death. If you are among the nearly 78% of Maryland adults who have been vaccinated, your chances of getting sick and hospitalized are extremely low, and your chances of dying are almost non-existent. Less than 0.01% of those fully vaccinated in Maryland have been hospitalized, and less than 0.001 of those fully vaccinated in Maryland have died, which means 99.99% of those fully vaccinated have remained free of serious illness. Look, I don't care what misinformation or conspiracy theories that you have heard. The plain and simple fact is that these vaccines are working. If you're still unsure about the vaccines, Here is the important fact for you to consider. Nearly every single person hospitalized or dying with COVID-19 in Maryland right now is unvaccinated. Those of you who refuse to get vaccinated at this point are willfully and unnecessarily putting yourself and others at risk of hospitalization and death. You are the ones threatening the freedoms of all the rest of us, the freedom not to wear masks, to keep our businesses open, and to get our kids back in school. And tragically, it may be only a matter of time until you do get COVID-19. We're seeing heartbreaking reports across the country that the first thing so many people do after being hospitalized with a severe, life-threatening case of COVID is to beg the doctors and nurses for a vaccine. And sadly, by that point, it's too late. We do not want any Marylanders or any more Americans to become one of these preventable stories. So please, just get the damn vaccine. These vaccines are free, safe, they work, and they're widely available everywhere. Everywhere all across our state at thousands of distribution points, including hundreds of pharmacies and primary care providers. To find a vaccine near you, go to covidvax.maryland.gov or call 1-855-MD-GO-VAX, where our call center remains available 7 days a week. Maryland has now transitioned from the crisis phase of the state of emergency to a more sustained, ongoing, long-term public health management response. All of the things that you've repeatedly heard me talk about for the past 18 months, testing, tracing, PPE, hospital surge capacity, and vaccines, all of the infrastructure that never existed that we had to build from scratch, have now become part of the day-to-day response operations of state government. While the pandemic is currently under control in Maryland, the unfortunate reality is that COVID and its variants are going to be with us in one form or another for the foreseeable future. And so we need to continue to adapt, to take the right precautions, and to look out for one another, which is exactly how we've gotten through this pandemic so far. It's how we have remained Maryland strong. So with that, Dr. Ted Delbridge, the Executive Director of MIMS, will talk a little bit more about the current situation with our hospitals.